everyone. So for today's panel, it's Sex, Illness, and Disability panel, which is moderated by Dr. Rachael Winston. So I'm just going to read the rules. We will be recording the session for those who can't make it or for you to rewatch this later. Recordings will be available for up to 30 days from when put up. We are pinning the video so that only the presenters will be recorded. This means you can choose to keep your video on or off. If you speak, the recording will pick your audio and not your name. You can type your questions in the chat box if you prefer, and depending on the presenter, you could private message them as well. Please keep your audio mute whenever you are not speaking, otherwise, you might pick up your background noise. We encourage you to check our Sugar and Spice Facebook group for latest updates and announcements. So, for consent, please do not contact other participants outside of the festival without their consent. You can always ask them for permission through the festival or Facebook group before messaging them. We do not want instances of participants feeling violated or unsafe. So, for emotional support, please email us at emotionalsupport@sugarandspice.asia. So, I'm going to give the floor to Dr. Rachel.
Good day, everyone. I think it's different times all over the world. Okay, and some of us are actually feeling really, really tired. But thank you once again for being here today. So, today, welcome everyone who's joining on our sexual illness and disability panel, one of the most awaited sessions for Sugar and Spice. All right. So, I'm Dr. Rachel, and together with me, I'm joined with Sydney, Regina, Mina, and also Lionel. So, we'll start off with Sydney, if that's okay. Okay. So, Sydney, tell us a little bit more about yourself.
Hello, my name is Sydney. I use she, her, hers pronouns. I recently just changed my title after a very, I guess, whirlwind week. Last week was a very whirlwind week in the Asian American community in the US. And I consider myself an edu guide, so an educator slash coach. And I empower Pan Asian women and non-men survivors of sexual violence to reclaim their wholeness and sensuality. So that's like a little bit about me that's relevant to our
Okay.
panel here.
All right, all right, all right. So, as you've mentioned, you are also a sex educator who has a past, who has a little past on a little bit of PTSD from what you have encountered. And how has that past encounter affected your current view, Sydney, towards sex and sexuality as a whole?
I think currently I view sexuality and sensuality as something that's an ongoing process. Like, I don't think I'll ever stop healing. I'll find like more things to heal from or like work on. And I feel like my PTSD is also something that isn't linear. And I feel like a big misconception about healing and survivorship journeys is that it's a linear journey when it's not. In my reality, I've found that like um, healing isn't linear and that I'm constantly finding ways that I feel need to like reclaim my sensuality as well as sexuality.
Mhm.
And so it's an ongoing process. I'm not sure if that answers the question, but
Well, it does. It definitely does. And I think I sort of understand. Sometimes when you say it's not linear, it's sort of like an uphill climb sometimes to get to a level that is um, sane before actually understanding the whole process, in the long run. And okay, do you think you mentioned in some of your writings that your aim was always to create an whole safe space for women, and non-men of color, especially survivors and all that. And is what happened to you in the past a sole motivation to creating that, or was it something that you always wanted to do?
I think that what had happened to me 3 years ago really just like pushed me and motivated me into being in the sexuality field in general. It wasn't so much of a thought when I was in school. I was studying to be a filmmaker. So obviously this is using my filmmaking skills in a very different way than I thought I would be. Um, So yeah, I think going through that journey and working and healing with the people in my network and the people in my community really pushed me and also motivated me to create braver spaces, because there's not a lot of those for survivors of the Asian diaspora.
Okay, all right. And in terms of intimacy, did you take time to get intimate with someone? Do you have trouble? I mean, does the PTSD itself, if you don't mind me asking, um, make you feel a bit difficult when it comes to actually dealing with intimacy?
I think because it's been a long time that I'm more confident now. Like, I understand my own boundaries and what those limitations are when it comes to like intimacy. But when I was first healing, I really just didn't know, and I felt a lot of shame
Mm-hmm.
when I couldn't. I guess the word would be like perform, or I thought I had to perform
Mm-hmm.
for past partners, and so that's something that I've been unlearning, and I feel like there's still parts of it that I'm still unlearning in my closest relationships.
Okay, so that's really good to know, Sydney. And Mina, okay, so
Hi, Rachel.
tell us a little bit about yourself. I know it's
Okay, so
in the morning, so
yeah, so I'm a well-being coach and a speaker internationally. I'm also a HIV activist because I'm a woman living with HIV, and I
okay.
also do volunteering with peer mentors. So I'm a mentor for mentees for people living with HIV in the UK.
All right. Okay. So, you're a person living with HIV, and I would like to ask, how has that affected your view towards sexuality or sex?
Well, I think it's I think like in life with anything, I think it because it's an STI, I think there's a lot of stigma around, sexually transmitted diseases, particularly around HIV. And I think that the narrative of HIV has always been one of, of shame and guilt and secrecy and the fear of being rejected. And I think all of that was part of my own journey. But I think that as you evolve, like you say, it's not linear, you're evolving and you're growing. And I think that you get more confident in accepting who you are and not letting your label itself impact your own, your choices. And my personal experience has been I've had men who've accepted me with my HIV status and men who ran away from it and didn't want to know. So I think we get rejected for all kinds of things. And I think HIV is just one of those, you know. But I suppose it comes with the territory, I suppose. Yeah.
And do you think when you're talking about stigma, I know, I mean, even in Malaysia, stigma is something that is really, really big, it's quite difficult to overcome that barrier getting to where we want to get. And do you think it's important for us to actually tell our sexual partners about our HIV statuses?
Well, I think, well, I think it depends on you as a person, and you don't necessarily have to, because most people who are on HIV treatment,
Mhm.
on retroviral drugs, you are not able to transmit to anybody. So actually, you don't need to tell anybody if you don't want to, long as you're taking treatment and you're undetectable. So I think that it's a personal choice. I myself do tell people actually, because it's just because I'm quite transparent, and it's almost for me, it's like a litmus to say, oh, are they going to reject me just for that? But you don't have to. I mean, I think if you're going to have a casual relationship, it's okay. You don't need to, long as because you're not going to transmit it over to anybody. But having said that, I always think practice safe sex, because you might catch something from somebody else. You know what I mean?
Yeah.
So, but I think the key thing is internalized stigma is one of those things where people feel the fear of rejection, the fear of not finding love again, or a relationship again, the lack of self-confidence and shame and guilt. But there's also the external stigma of how you're going to be perceived that a lot of people experience around HIV, and we forget that there is that kind of perception about what people think about somebody who's got HIV. So, so there's a lot of issues and complexities around some of that as well, for sure. So I think you have to kind of go through your own journey, but I think get the support that you can, because I think in the UK we have a lot of peer mentoring support. I don't know what it's like, in other countries, in South Asia, but I think that that's really important that you have somebody who is of a lived experience who can help you through that journey. Particularly, the biggest thing is about telling somebody and the fear of being rejected, whether it's a family member or whether it's a new partner or even a friend or a work colleague. Yeah.
Yeah. But I think, in different countries, like in Malaysia and I think in Singapore, it is important for us to actually disclose our statuses to our partners. Most of the people who are living with HIV here are usually registered in the system. It's very important to, yeah, it's something that is a must. And then they usually need to know that, okay, this person has HIV and what are the risks and outcomes and all that. Of course, if how we want to take it, not everybody will be usually checking the register to see if this person is HIV or not, you see. But yeah, our honesty towards our partners is one thing, of course, to tell them that, yeah, I'm living with this and I'm coping with it and I'm in an undetectable level, and whether the person will accept or not, it's up to them. But it's always important to at least be open in that. I mean, that's how it is here. But like I said, I mean, I agree with what you said as well, in terms of the support and the encouragements to actually get there.
But
And
I think there's also a right to privacy as well, I think. And I think it's okay not to. If you're untransmittable, you don't need to. It's nobody's business to know, actually, I think, actually. And I think it's a fine line, depending on that. So I think you have the right to privacy. I think that's important.
true. Okay. And you did mention you do a lot of work in terms of personal transformational leading for people,
Yeah.
helping them fulfilling lives with greater sense of purpose and passion. So, how does this actually become implemented with someone who has HIV, and if he or she is still struggling to overcome the stigma of the disease?
I think often, when I've done my peer mentoring or one-to-one work with individuals, it's really about a lot of the time it's about acceptance of the actual condition, and often they're in denial or there's anger or and it's often just saying that actually it's not end of the world, and often people define themselves, they forgot their own identity, and suddenly the HIV becomes their identity. So it's saying it's part of that journey is accepting your HIV status and saying it's okay, because often you feel like it's a loss, but it actually can be a gain, because so it's about self-empowering an individual to kind of really celebrate who they are and bring that confidence back to say you're more than just the HIV label, or a diagnosis, and it's coming back to terms with yourself and a new self, that, okay, so this is Mina, and I'm Mina with HIV, and so what, but it is a journey, because I think there's a lot of internalized stigma that often an individual has to go through. And also, so if I can give you an example, one of my peer mentors that I was mentoring, when she first came to me, she was in absolute tears, and she would say to me, Mina, am I ever going to find a husband? Am I ever going to have children? And so we worked through that process with her, that actually women with HIV can have children, can have, relationships and positive relationships, and have, meaningful, lives, because when you're on treatment, you can live like everybody else. It's not really, you're taking one tablet a day or two tablets a day. And it was about 2 years later, she rang me to say, I'm getting married, and she's married now with children. So sometimes it's also letting people, women know as well that they can have children, that they can have partners. So it's always dispelling some of the myths and misunderstanding that your life isn't anyway diminished. It's actually, you can get back to some normality and some level of purpose again. Yeah.
Thank you, Mina, for that. So, we'll get to Lionel. So, hello, Lionel.
Hello.
Hi. So, would you like to tell us a bit about yourself?
Yeah. I go by he, him, and his.
Okay.
So I run workshops to help people in their personal lives as well as relationships. I also do a process called mind clearing to help people get through the blocks in their minds
Okay.
to live a better life.
Okay.
Essentially similar to life coaching, but we work differently.
All right. Okay, that's really good. So, you did mention previously in one of your writings that you had a stroke, if I'm not mistaken, right?
I had a heart attack
Heart attack. Okay. So that was how long ago?
about a year and a bit more. Last is in February 2020.
Okay. All right. And how did you actually uh, cope through the recovery in terms of sexuality? I mean, was it?
Recovery was great. I actually could have sex almost immediately after,
Mhm,
but the issue was about 3 to 4 months later, the doctor put me on a medication called beta blockers.
mhm.
So it reduced my heart rate as well as blood pressure. That led to ED problems, erectile dysfunction problems, couldn't remain erect, couldn't follow through.
Okay.
And it's led to a lot of issues, self-confidence issues, issues with my wife and things. Basically, what I was used to, I couldn't do again. And I also realized that prior to my heart attack, I had similar problems, but it was also probably due to not getting enough blood flow and not realizing it.
Okay.
Yeah.
So that must have been like a little bit of a stress with you and your partner as well during.
Yeah, it does. It did lead to quite a lot of challenges that we had to work through.
Okay.
So the communication part of it is was important.
Okay. If you don't mind sharing, Mr. Lionel, how did you actually work through these challenges? Because I think a lot of people out there need to know when dealing with similar situations like this, how do we actually, I mean, do we lead to result into therapy, or do we sit and talk it through, or do we come to
Yeah.
an agreement?
Yeah. I would say in this kind of issue, it's never a one person problem. It's always a two. Actually, it's threefold. Um, both partners have to do their individual work and work through their own issues, their confidence, their expectations, as well as the couple have to go through the process of coming to a new way going forward.
Mm-hmm.
It might be that it just not going to happen for a while, or it could be it can happen, but it may happen and not happen right there on the spot. So, because that may lead to one partner feeling that she is not attractive enough, does not is not able to perform. All these kinds of things can come up, and being honest is important, but being honest also means being vulnerable, and being vulnerable also affects the ego, it affects the what I used to be able to do, now I couldn't. That's also a process of aging. I'm pushing 50, so there
Okay.
is there
Okay.
is something that you can't beat. It's called father time.
Yes. That's good. That's good. But I think it must have been a real uphill climb, dealing with emotions, dealing with the stress of trying to communicate with your partner, and of course, the ED that set in because of the medication, and wife similarly went through an illness previously. So how was it? I mean, how was the intimacy between the both of y'all during that whole segment? Was it did y'all come to an agreement, or was it, or did y'all work things through, or was
It,
it like a stall standstill? Wow.
so my wife had fibromyalgia for 3 years. So for most of the time she was in bed, and intimate touch was painful.
Mm-hmm.
So stroking of skin hurt at that time, and she was a very she used to be a very touch-based person. She still is, and the thing is that led to a lot of intimacy issues at the time where she had to go through. I mean, it for me too was the difficult part for me as the caregiver at that time was, now what do I do? I can't even touch her. And my my kids actually felt it too, especially my daughter. When my wife recovered, the first thing she did was jumped on her mother because there was a lack of intimacy in the touch sense. So if a person is very based in touch to express love and affection, that affects it. So we had a lot of conversations, but at the same time, it was also a challenging period which my wife herself had to work through, and me, because I was used to it. And that kind of led to habits, and which we are now also working through, because it was one way, then it had to be another way, and then now that is gone, and now we got to create a new way. So it's an ongoing process for the last 7 years.
But I think the most important thing is, regardless of the number of ways you guys work through, communication, open communication is very, very important. I think it's always important to keep our partners in the loop on what we're doing, what we're planning to do, what we're planning to change, and I think you've worked through that pretty well, Lionel. Okay.
Well, I wouldn't say pretty well. It's not always graceful.
Yeah.
Some things we still, I think it is going to be a constant and ongoing process. And both sides will have to actually, besides just the communication, both sides have to do a lot of self-reflection, as well as acceptance of the way things are, and as well as the way forward. Because it's not always about, I want it this way. I have a tendency to do that. So I have to admit that. So I want it this way, and that's the only way. And my wife usually takes a step back. But there are times where she said, no, I'm not taking a step back on this, and this is what we're going to have to work through. So depending on how the relationship dynamics is, because every couple is going to be different. I can't say that one person or one way is the way forward for every couple. However, the open and honest communication is important. Coupled with that is self-reflection, as well as self-admitting that, okay, there are things that I need to change, not just my partner.
Okay. Thank you, Lionel. All right. So I'll get back to you and Mina and Sydney. So we'll move on to Miss Regina. Hi.
Hi everyone, I'm Regina, and I'm a mother with three boys. My eldest son Benjamin is 32 now, and he was born with Down syndrome. At that point in time, after he was born, I quickly went into voluntary service as a means of coping with my situation, because that was the only way I could cope with the pain at the moment, the trauma of having a child with disability. And once I was in that community, I realized there was so much to be done, and that there are people with intellectual challenges, particularly Down syndrome, are unable to articulate their needs, their rights, and issues surrounding them. And even so, for their family, it's still a stigma for families with children with Down syndrome to speak up. It's still known to be a curse. It's still known to be something bad that you have done in your lifetime, or so people are not willing to step up and talk about it. So for the last 30 plus years, I have been volunteering in this particular community. I'm not a specialist in Down syndrome, nor am I an educationist. But what I do bring along with me is my 30 plus year journey in this community, and my willingness to talk about issues surrounding this community, as well as not be uncomfortable to be in a public place and talking about more understanding and awareness. So I hope that in reaching out to as many caregivers, service providers, professionals, more understanding and more empathy, you know, uh, would be, will be shown within this particular community. Yeah.
Regina, I wanted to ask you, our son is 32 years old, right?
Yes.
Okay. How does he have sexual needs when it comes to sexuality, sexual needs or attraction?
Yes, he does. So
Yes.
I like to share this little story which I experienced about
Uh-huh.
15 years ago.
Okay.
I've always thought that I was pretty modern, pretty up to date and pretty broad-minded person. But I think I'm still Asian, a typical Asian mother. So when Benjamin was about 16, 17, I keep getting, complaints from teachers and other parents that he was touching himself in public. And of course, every time I hear about it, I will give him a good, scolding and like, don't do such things. You can't do. It's shameful. And he will always end up in tears, and he would be very frustrated, and will go to his room, and I won't see him for the next few hours. And it's always, I'm sorry, mom. I'm sorry. I won't do it again. And then 2 days later, it happens. So it was very, very frustrating. And all I could do was just pile on the guilt, you just repeat and repeat, don't do that, don't do that. It's bad, it's unacceptable. The police will come after you, and all sorts of very negative remarks. And I must say, 15, 20 years ago, there was really not much you can find out about such issues. I happened to attend a talk on sex education. It wasn't a talk on sex education for people with disability. It was just a general talk. And I said, okay, I'm going to go in there and see if I can learn something new. And after the meet, and of course, the context of the meeting of the seminar had nothing to do with people with disability. And I took a chance to speak to one of the speakers during a tea break, and I told her my situation.
Okay.
And she said to me, you have two other boys who are able-bodied. And I said, yes. They're probably doing exactly the same thing, being this is a very human and a biological need, except they know when and where to do it. And that's the only difference between your two other boys and your boy with Down syndrome. And he was like, okay, it just dawned upon me that, maybe it would work if I explain to my son, you know, in those terms. So I went back, I put him aside, and I said, Benjamin, you can do this. It's not wrong, but you can do it, not do it in public. You can only do it at home. You need to go to your room and lock the door, And it was like a light bulb moment, his face light up, his eyes light up. He was so grateful. He was so happy that I was like close to tears, So like, what have I been doing? I was piling all this guilt for the last 2 years. And this poor boy was like suffering and doing all the wrong things. And I'm sure there are dozens and dozens of people with the same challenges who are going through the same pain. And unfortunately, I mean, of course, I must say in Singapore today, especially in the Singapore context, there's a lot being done for people with Down syndrome, more job opportunities, more chances to have independent living, independent traveling. But this issue of sexuality is hardly ever discussed. I think caregivers don't look at their persons, at their adults with Down syndrome as somebody that may have sexual issues or may even have sexual needs, because their mental age is still a fraction of their chronological age. Like my 32-year-old son, he probably has a mental age about 7, but most caregivers do not understand that he actually does have a body of a 32-year-old man. So when he was 17, he had a mental age of 4, but he had the body of a 17. So he had desires, he has stimuluses that his mental brain could not understand. And he was exhibiting it in various forms that caregivers, again, tend to look at them as eternal children. And we never focus or never even look into issues that affect them sexually. So what I try to bring up in the open is that, yes, our young adults with Down syndrome do have sexual needs. Let's teach them how to manage these sexual needs without feeling, that it is something that is not acceptable, it's against our culture, that we like to keep hidden, because it will lead to a lot of, I would say, frustration, as well as maybe unacceptable behavior in public, which eventually will get them into trouble. So hopefully, with more, more people spreading these issues, people get more caregivers and siblings. Subsequent siblings will be the caregivers, and even service providers will be aware of this issue.
Yeah. So do you think, I think one of the main things, Regina, is to make sure that we always explain to our
Yes.
children, regardless of whether they are having Down syndrome or not. I
Mm,
think changes that happen in their body must be explained. You know,
correct.
a lot of people overlook people with disabilities and illnesses
Yes.
because they feel that they might not understand because they are already consumed by their illness or their disability. So
Mm,
the sexual development or the sexual desires that they will overcome or they will go through are not significant enough for us to actually take into consideration. Okay.
correct.
So, and
Correct.
a lot of stress because as an individual, as much as he's going through whatever he's going through, I think there will be still changes that are happening in a normal person's body. And I think he's going to be very curious. And that puts a
Mm-hmm.
lot of stress on him as well, as to whether he's doing something right, whether he's doing something wrong. And do you think it's only important for the caregiver or the parent to talk about it? I mean, having living with siblings who are also guys who probably do the same things, do you think it's also important that they share their experiences with their brother, or is it something only that the caregiver should be responsible in explaining?
But even it's always, I noticed that it's always the parents that take the lead. If the parents are willing to talk about it, siblings will be also more open to talk about it. Unfortunately, it's still the mindset in Asia, especially in Singapore, as I said, the last 30 years, that
Mhm.
parents tend to only take upon themselves the so-called burden of looking after this person with a disability, and the siblings are some more often than not involved in the lives of this their sibling with special needs. So it's not uncommon to know of siblings who know hardly anything about their brother or sisters with Down syndrome, which is very sad. I try as much as I can to involve my two boys in the bringing up of Benjamin, and but I cannot say so for, I would say, most of the families. They think that is such a difficult situation as it is. And I think in our, again, Singapore context, parents are like, okay, you go and do your studies, you go and do your ECAs and excel in taekwondo or street soccer, whatever. So, this sibling of yours that needs so much more care, I'll look after. And we even have situations whereby the father will look after all the kids without Down syndrome, and the mother will look only after the kid with Down syndrome. So it's in fact a separation of roles. So that's even more, I would say, not a very good situation, because you end up that they, the siblings do not know anything about their brother or sister, and eventually they are going to be the caregiver,
Mm.
and they may not be able to cope when the time comes.
Yeah.
So it is good actually for parents, the primary caregiver, to initiate, you know, a family caring for the person with special needs, whether it's a Down syndrome or autism, rather than taking on the responsibility themselves. So I would say, in answer to your question, parents need to initiate.
Appreciate. But there is no harm for the siblings to actually also.
Yes, yes,
I've seen some parents, who are in a similar situation when talking to their children, if they're probably the other son is not having a disability and maybe they're living with an elder son. Whenever he talks about something sexual, their parents go and say, "Hey, don't talk to your brother about that. He will not understand.
all
Don't,
right.
he's still a child. Don't talk things like that." So I think they sort of put a barrier and a wall right from the beginning, like it's not normal. So they do not normalize the whole situation with the family. So it's always looked at as something that is abnormal, and the child grows up with this mentality that, okay, all these things are abnormal. So when I feel things like this, it's abnormal,
All
So
right.
that is a very important thing that we need to actually address from very young with the
Ye-
family. Okay.
yes,
Thank you, Regina.
thank you.
Okay. So Sydney, um, I'm very excited. I mean, I'm a sex educator myself. I educate people on sex and all. But I just want to know, what was your motivation, the main motivation to become a sex educator?
The main motivation for me to become a sex educator was to empower other survivors, especially those of the Pan-Asian diaspora, because at least in the US, the imagery of who gets to be a survivor is often a white, cisgender, heterosexual woman, and that's definitely not true. The statistics, I think the one from like 2018 is that 23% of Asian and Pacific Islander women are affected by sexual violence. Obviously, I think the number is obviously underreported because it's culturally stigmatized to come out about sexual violence. And if you are a victim survivor, um, it's just not something that a lot of people talk about inside of communities, but also outside of communities. There's also not a lot of, I guess, culturally curated support. I feel like there's some, but not like a whole lot. I wish there was more. And that's also like what motivated me to tell my story and keep on doing the work.
Mhm. Okay. So, Sydney, what are some of the challenges that you have actually faced along the way? I know that you've had an assault in the past, so sometimes I think the degree of assault sort of like affects the way we sort of like get back to our normal sexual lives. You see, so the worse the degree of assault, the more difficult it is to actually get back on track. So, in terms of what you went through, how was it for you to actually regain the strength to lead a normal sex life again without having flashbacks of the trauma you went through, and in particular, what was the main trauma that really affected you?
Ooh, that is a good question. I think the main trauma that really affected me is just how I function in relationships with the partners or past partners that I've had. Um, and also emotional intimacy, which I feel like is something that's not necessarily talked about, but also definitely connects to physical intimacy in that way and just feeling safe. It took me a long time to get there. And it's still like an ongoing process of checking in on myself to see like, oh, is this something that I'm still triggered by? Is this a new trigger? Because I feel like I learn about new triggers all the time. Even though it's been 3 years since my assaults, it's still something that's ongoing. But it's taken me a while and a lot of therapy to get where I am now, where I understand what my boundaries are and how to maintain them and enforce them when need be, and have those difficult conversations with people that I have intimate relationships with.
Okay. So do you agree that someone with PTSD will eventually have a long-term barrier in getting intimate with someone? And will this barrier be something that is constant throughout their life, or will it be something that they can overcome eventually with therapy, or, you know?
I think it's different for every survivor, to be honest. Personally, for me, I had a trauma response of being hypersexual after my assaults. So it was not something that I had to or I had thought about until I like really processed what happened to me 2 years ago, when I really started intense therapy. So I think that it varies for every person, but personally for me, um, I think that I've been able to overcome it to a degree, but it's still something that's always there and that I'm always working through in some type of way.
Okay, all right. Okay, so well, if you were to come across someone who experienced something similar to you, I mean, what you experienced, what will be your message for them, dealing with what you've gone through?
I think my main message is to, choose what you want to do in terms of your healing on your own timeline, because you'll have a lot of people tell you what to do when you tell them that you've survived assault. They'll tell you to report. You're not obligated to report. If you want to report, you can. But if it's not the safest, like most healing option for you, then don't do that. Like, I feel like survivors and victims aren't told that enough, that it's their choice on their journey to make whatever decision that they need to make and want to make that will help them and fulfill them. And that doesn't necessarily mean maybe typical ways of healing or justice. Healing and justice looks different for every victim and survivor. So something that I wish I had known 3 years ago is that it's up to me and it's not up to anyone else, because it's my autonomy. And that's something that's not often talked about within not survivorship spaces, but generally when it comes to survivorship, a lot of people don't talk about it. Even people working in survivorship sometimes will like push survivors to report when that's maybe not the thing that they want to do, or their body and intuition is telling them to do. So really leaning into that, I think, is my biggest piece of advice, because that's how I got here.
Thank you. Thank you for that, Sydney. It's really, I mean, I've dealt personally with people who have been through assaults, and a lot of them have different degrees of healing, and I think their journey is remarkably very, very strong, to actually listen to how they actually overcome it, and what affected them, and to gain back, the strength to have a normal, intimate life with someone, that is a challenge without having, because PTSD is about the mind as well. Your body might work towards something that you want, but if your mind is not settled, it's always going to be a constant challenge. As much as we always say, oh, okay, she had PTSD, for many out there it's usually just a word that they use, PTSD. Okay, but to live in it, to experience it, and to overcome it mentally, emotionally, that is the real challenge. And it's great, Sydney, that you shared, your take on it. And it's, thank you very much on that. Okay, so Mina, you know how are you feeling? I hope you're
I'm good. Yeah, I'm still here.
so. All right, we touched a little bit on stigma, and I want to actually, how does stigma actually, do you think, um when someone is actually diagnosed with HIV, does the stigma sort of like create a barrier in their minds into how intimate they actually want to become with their partner? What is your take
I
on
mean, it can do, absolutely. I mean, I think I can speak from my own experience, but also the women I've peer mentored as well. Often it's that, it's just that lack of self-esteem and confidence that you have because you're dealing with with the situation, with the diagnosis yourself. And I think, I mean, I probably didn't have a relationship for about 5 6 years, before I went back into it, kind of went back out there. And I think it's more about your own self-esteem and confidence, which gets really knocked initially. And that's where the stigma is, and also the fear of rejection. That's, what if I tell somebody and then they reject me? I think that's the biggest one often. But I think it's also so I think it's really important that it's always a journey, and I think that you just have to kind of go for it. You have to just build up the courage, and I think it's about self-acceptance, that you've just got to kind of love yourself and appreciate yourself, and say that you are more than just the HIV label, or the diagnosis. You've got to be beyond that, and often just working through with people to say it's okay, you're still you, and people can reject you for all kinds of reasons, like I said before. And I think it's important that people just, individuals, have their own journey around that, if you know what I mean.
Yeah. Well, that's, when it comes to dealing with another person, there is also something you call self-rejection. I've personally come across people who were diagnosed with HIV, who had active sexual lives and they were happy, and then suddenly when they're diagnosed, they reject themselves. They put themselves like in a barrier, saying that, you know what, I am just not going to have sex anymore. It is
Yeah,
not healthy, and I'm probably going to be spreading the disease, and that leads to a lot of mental trauma as well.
yeah.
So you come across, I mean, in the group, the work that you do and the people that you meet, have you come across people who actually dealt with this kind of situation before?
Yeah, I mean, I think I have, but what tends to happen is when I talked about the U equals U, the untransmittable, undetectable. That is really important, because I think that's a game changer for people living with HIV now, because that research was done, quite a few years ago and international, that actually if you're taking treatment, you are not going to pass it on because you don't have the virus in your system to pass it on to anybody. It's sitting dormant, like myself. And often you just need to have that understanding, that actually, and often you got to remind people that you're supporting that. Did you and lot sometimes people don't know that, and some people do when they're being diagnosed. So it's important that people, in the newly diagnosed, that information is given to them, because that's quite self-empowering to say that, you if you're on treatment, and you're undetectable, you cannot pass it on, and so therefore you can have sex, without the fear of passing it on, because that's one that many years ago was a big barrier. It isn't anymore. So I think it's important that people have the right information, to hand, and so they can then negotiate that with the partner or the person they say meet, or they're dating or seeing, and saying, look, this is a situation, and that I'm not infectious, I can't pass it on to you. And that's quite empowering. That's a game changer for sure, I think. Yeah.
Yeah, I think it's important, to recognize things like that, because I think a lot of people overlook when they talk about stigma. They always focus on the third person and how they look at themselves. Sometimes we ourselves might look at ourselves as a stigma, saying that I myself am not healthy to go out there in the environment and actually spread
Mm.
this. So it's coping with both of these that's very important.
I think it's external stigma too. Let's not forget that, because I had a peer mentor who, who worked in who actually worked in a church, a Christian church, and she did not want to let her employers know she was HIV positive, and because because even the fact it was a spiritual place, just a fear of being judged there, or even, so it's important that sometimes people don't, they need to go for treatment, or they need to go for counseling or something, but they don't want to know that they don't need that, they don't want to tell their workplace. So it's quite interesting in Singapore that you have to disclose, which is quite interesting actually. I
Yes.
don't know, for me that's a challenge around civil liberties, but hey ho, I'm not sure.
I
It's
think it's
interesting.
about, I mean, we do disclose, but the privacy level is protected to a certain degree.
Oh, okay.
We do not disclose it. I mean, it has to be registered in the system here for documentation purposes, because this person wants to do, like, for example, blood transfusion, and stuff like that. So it has to be in the system to make sure that they pass all these criteria before a transfusion is done. So for
Yeah.
purposes of that, yes, we need to register them. But of course, when in hospitals who we're sharing it, the wife or the partner that's married to this person has to know the status. There is no two ways about it, saying that we cannot. I don't want to tell my wife, you can't do that here. I mean, if you're legally married
Oh,
to this person,
interesting.
it means you're also having sex with this person, and she needs to know. She has the right to know about your status. But
Okay.
of course, when you are, that's why marriage is legal here. I mean, to have it legalized, because it's something where that people are going to know that you all are together. Whereas when you're having partners, just probably dating someone, of course, then it's your privacy to disclose or not disclose. Okay. But here we will tell it's better to disclose, because it is always fair for the other partner to know your status, regardless of whether you're undetectable or detectable. Of course, if you're detectable, it is not advisable to be having partners and having sex with them.
Absolutely. Yeah, yeah,
But if you're
yeah.
undetectable, there's no reason being shy about it. But I think when you mention you equals to you, that is the very same thing that we are struggling actually right now to uh, create awareness on.
Mm.
Because as much as it is all theoretically documented, for the mind to accept it is going to be difficult, because I'm having sex with this person and he or she is HIV positive, and it's always going to be at the back of our minds. And to accept something theoretical in our minds, sometimes it takes time. you know
Yeah, I think it's a cultural shift. It's an attitudinal thing, isn't it, really? And I think the more we kind of are open about it and let people know that people living with HIV can live normal lives, they're not transmittable to anybody else, and I think that the more that message gets out there, the people then living with it can be confident with that as well, So yeah, it's not always straightforward, but it's a work in progress, isn't it, really?
yes, definitely.
Yeah.
Thank you so much for sharing that. So if that's one message you would like to give to anyone out there in
Do you know
regard.
anybody? I think So I think anybody living with HIV, get the support, because I think one of the biggest issues people living with HIV is they live in a profound sense of isolation often. Often they don't tell anybody. Often. So I think it's important that I think that's the case for the UK anyway. And I always say, reach out to the HIV charities, get the support that you need. If there is peer mentoring in your country, get it, because it's really valuable. Get the support where you can get it. And I think that's really important. And I always say celebrate and love yourself. You are perfect just the way you are. I think accept you for who you are. And celebrate you. That's what I would like to say, really.
Okay. All right. Thank you, Mina. Thank you so much for
Okay.
sharing that. So, Lionel, how are you feeling?
I'm doing well, thank you.
Okay. I wanted to focus on something which I noticed you spoke just now. You said there was a time where it was a little bit of a stress for both you and your wife in terms of communication, and you felt like you couldn't touch her, and there was a little bit of a blockage there. And how did you cope with that? I mean, apart from communication, if I were to talk to one of my patients who come to me and they were to tell me, I feel a strong sexual urge, but I cannot express it on my wife. So how do you actually how do you deal with things like this?
Well, that will be, it would probably vary individual to individual and how they would like to lead their lives. Some people would choose to do it outside of the confines of their marriage if that is something that they could do it with or without their spouse's consent. So that's totally up to them. That is one way. Because particularly here in Asia, the moral value side of the equation is very highly, still highly priced, right? So the fidelity and all that is something that people, I shouldn't do it outside. It could be that. But sometimes that's what they need, particularly if the spouse is totally unable to have sexual relations. Then now what do you do? So that could be that is a challenge that each couple will have to deal with on their own in terms of coming to terms with what I can give, what I can't give, what I can do, what I can't do, and what are we going to do about that? And this is the difficult part that has to be navigated in each and every couple, regardless of whether they have a disability, but the disability just puts the spotlight on it even more.
Yes. Okay. So you're saying it's okay when you say it's all right to push boundaries sometimes. It is also important that there is mutual understanding with your partner as to why you're doing those things compared to what
Mutual understanding is one thing. I think the other part is consent.
consent.
The issue is this. It is about the intent of the communication.
Okay.
If the communication is to reach understanding, okay, this is the way forward, and you both understand what you're talking about, it's fine.
Mhm.
But there are times where one person might hold back some part of the communication and it doesn't reach full understanding. So the both in the couple could think that they are agreeing on something, but they are both agreeing to something different.
I see.
Yeah.
Okay.
So one of the processes that we teach people is ask couples to sit down in front of each other and just go back and forth. Tell me something you think we agree on. And then one person will say something and I never agreed to that.
Yeah.
So it becomes a big issue in couples, especially when they are already dealing with their own issues
Mhm.
and now having to deal with the issues that comes out of whether one person is ill or has a dysfunction or disability, particularly if it comes on suddenly. If it's something that comes on over gradual time, people tend to adapt. But if it happens suddenly, a stroke, a heart attack, an accident, something that overnight changes the way that you relate, it can and usually leads to a lot of pain and suffering each party is going through. And to be fair, it's difficult for them to come together to resolve that pain. They have to resolve it outside. That means find support, whether with friends, counselors, therapists, or family members, and then come together and deal with the couple hurt, the couple suffering. Because there's individual suffering and then there's couple suffering.
Okay.
Both affect each other.
I've had similar patients who have come to me, and they always result in having an affair, because of the stress. And it's understandable to a way, because like you said, if it's something which gave them time to adapt, it's different. But when you're leading a normal sexual life and suddenly there is a stop to what you're used to, it puts a mental stress on he or she or whoever she might be, and they result in infidelity or having affairs because they feel that is an easier way to express their stress. And what's your take, final, on relationships like this? Do you think it is better to be direct and tell your partner regarding the stress that you're going through, or do you think it's okay to not hurt the person, to make, because sometimes when we tell them about the stress that we're going through in terms, they feel less of a woman or less of a man because of my disabilities, I'm not able to satisfy you, and that's why you're going into this. So it's very crucial as to how you actually sort of like tackle it, so that none of the parties get hurt. It's very important, and what's your take on this, to have relationships, to overcome your sexual desires?
Well, I come from the space of there is no judgment on that, whether it's right or wrong,
Okay.
because each individual will have to make his or her own decision about how they would like to lead their lives. So if they feel that it is something that they need to do for themselves, at the same time trying their best not to hurt their partner, then go ahead and do that. However, my experience working with people is this tends to hold up in their mental psyche, because we in mind clearing we call it a withhold. It's something I'm withholding from the person I say that I am connected to and I love and cherish. And if that relationship is a loving and cherished relationship, this tend to bring up stuff that is held up, and then it becomes, the distance gets further and further apart. And most of the time, the distance gets further and further apart over time. People don't realize it. It's the boiling frog syndrome, right? You put a frog in a room temperature water and slowly raise the heat, the frog will get boiled because it just adapts. And this is what happens in that relationship. And that it adapts to a point where it's no longer adaptable and it gets boiled over. Right. So I don't see there is anything morally wrong, although there are some segments of society and people who will say that's no way. So, but it doesn't take into account the individual well-being, because we are whole people. We have physical needs, we have emotional needs, we have mental needs, we have spiritual needs. And each of this plays a part in your makeup on how you approach a disability, you approach an illness within a couplehood, and how you deal with it. Because some spouses may go, you just go ahead and do it, be safe, don't bring it back to me. Don't bring anything back to me. Some could do that. Some could go, no way. I know you're suffering, but too bad. So that, yeah, too bad. And that brings up stuff. It could, and it's not necessarily because they want their partner to suffer, but it could be because they are suffering and don't know how to express it and don't know how to process it and didn't get the space to process it. So that becomes the challenge. So, which is why I say both individuals in the couplehood need to work on their own thing, their own stuff, and then come together as a couple and deal with the couple stuff.
Mm. So it's
Because the couplehood is not the place to deal with your individual stuff. Because it is not set up that way, because you're not each other's therapist or counselor or coach. Your partners. So your way forward is a vision together forward, but each of them also have their individual vision. So they need to clarify those and then come together and see how their individual vision can come together as a couple vision.
okay. All right, all right. Okay, thank you, Lionel. I think I sort of get your idea. I mean, it's very nice to actually look at it individually. I mean, a lot of people always climb it all together and say, when we're married, we're a couple, it's always us and our issues. But we fail to see sometimes that everyone goes through individual challenges. Like you had an AD problem because of the side effects from the medication. And that's not something that sometimes people are comfortable to talk about as a couple. It's something that you say, I want to deal with it myself first. I need to figure out what I need to do and how I need to go about it. And I think it's very important to always delineate what is important to talk together and what is important not to talk together.
Yeah, I have a caveat there because at the start I was like, what the hell? And I dealt with it myself. I reached a point where I couldn't. It has to be, and I can see it's affecting my partner. It's like, oh, we got to deal with this.
Yes.
I mean, I was glad after the medication, they finally stopped that medication and things returned to better. But I could see over the years what happened and over the months. So in that sense, I would say people need to come to terms with their own disability or illness, especially if it happens suddenly, and that may take as long as it takes. Sometimes people never recover from that trauma, so to speak.
Yeah.
Right. There is also, we were talking about PTSD earlier. There's also PTSD with things with performance function, meaning where you couldn't perform, where a person cannot perform as he or she used to perform. And then after they recover physically, the mental stress is still there and they keep wondering, am I be able to perform? And that leads to performance problems, especially for men. I mean, or people who have penises, right? So it becomes a problem because it's a PTSD that they had about previous inability to perform. And they have no problem physically. So I faced that too. I had to work through that on my own too, with my own, that's my individual thing to work with. At the same time, I need to communicate that to my partner to let my partner know that this is what's going on.
Right. Okay. Thank you, Lionel. I think I've got a whole new view to things now after talking to you, but thank you. Thank you for sharing that. Just Sydney, wanted to ask you on what Lionel just mentioned on the performance anxiety or performance PTSD that people go through. Did you have that? I mean, did you have to go through that part
Yeah,
while?
I definitely. Yeah, definitely in like the first relationship that I had, which was like my first major, I guess, adult relationship in my life, that I had after the assault, there was definitely this performance anxiety that I had felt around my partner, even though they didn't have expectations, but for some reason in my mind, I had all these expectations that, oh, maybe we'll think XYZ or whatever. So I definitely relate to what Lionel was talking about performance anxiety, because that was something that I had gone through about not feeling good enough sometimes, or like not feeling that I could be good enough for my partner or ex-partner. Well, yeah, ex-partner at the time. Yeah.
Okay. So that was really a challenge. I mean, even people who don't go through trauma in the past, they always sort of relate to sexual experiences. They have this mental benchmark in their head saying that, okay, a good sexual experience, this is what I actually need to go through and this is what I need to do. And they always have that that thing that they're living up to or wanting to perform according to what's in their mind. And when they don't do that, they have this sort of like trauma, like, okay, maybe I'm not good enough for my partner, maybe I'm not doing it right, or maybe, I'm not satisfying him the right way, because in my head, this is what it's supposed to be, and this is not what's happening. We sort of like see ourselves in sort of like our own mind movie, and if it doesn't happen that way, we sort of get disappointed. So how did you actually come to terms with it, Sydney? How did you tell yourself that, what, this is just in the mind, and this is actually who I am, and my partner doesn't have expectations? Did you talk it out? Did you communicate with the person, or did you just come to terms with it and said, what, this is me and this is how I'll be, and I shouldn't let what happened to me in the past affect me on my sexual experiences or performances?
I think it was a mix of going to therapy consistently, because I used to go weekly for like the last 2 years of my life. Now I finally moved to bi-weekly. Um, and as well as like having open communication with my partners whenever that was, especially in my last relationship, having that open communication and talking through it, even though we both knew that like this wasn't a problem that's going to go away overnight, and it's not something that's going to be solved overnight, but talking through it really helped, in addition to going to therapy weekly and working through it on my own.
Okay, right. Thank you so much, Sydney, for that. Regina, hello. Okay, I wanted to ask you, um, I know we spoke about communication, open communication with our children who have disabilities, especially in your case, Down syndrome and all. And how would you go about explaining to your son about sex? I mean, now that you've created that open, uh,
Mm-hmm.
saying that, it's okay to talk about it. I mean, I'm sure being an individual who finally sees his mom or his dad opening up and talking about it, the curiosity in a child will eventually come up. Sexual experiences. How would you want to actually break it up and say, this is what it is, and this is how, is it going to be like how you tell your sons, or will it be a bit more sensitive than usual?
Uh, well, I do have communications with my two other kids without challenges about sex, and then they always tell me, "Mom, you're so gross," you know. I think they were still very Asian boys, and like, you know, the first time they were traveling overseas. By the way, one of my sons is in the check in this talk. They
That's
will
it.
verify that I did that. And I actually said, please, the first time they were going overseas, and it's like, bring a condom, you know, like, you're like, Mom, you are gross. You're not going to do that. I said, it doesn't matter. Just bring one, you know, because I don't know what you boys will be up to overseas. But with my son with challenges, um, it's a different approach to explaining to him about sexual matters. So, I try to tell him that, sex is between husband and wife. You need to get married and then you have sex, but you do have, the need that you feel to self-gratify. It's not something that's bad. It's just that you know where to do it and how to do it, and also how he communicates with people of the opposite sex. Like if he's around a girl that he likes, in his group of friends, there are certain boundaries. Uh, Parents in our community are super sensitive, especially if they have girls. You know, so when it comes to the girls, is most of parents will teach them, no touching of boys, don't even go within 3 inches or 6 inches of a boy and things like that. So we do have to respect that, the different families have different approaches to the opposite sex. So in terms of how he communicates with members of the opposite sex, it is a lot more restrictive, yeah, because the community that he is actually active in have very, I would say, uh, very traditional views about interacting with members of the opposite sex. So they just want to be on the side of caution, don't go near a boy or don't go near a girl in case, you touch the girl or the girl touches you, which I have seen very often in my voluntary work, that among the adults with Down syndrome, they do have a lot of affection for each other, or members of the opposite sex. They crave the intimacy. But more often than not, they are pulled back by the parents or the caregivers. And I can understand that. I don't say that what the parents are doing are wrong to pull back the intimacy. They are just being very cautious because at the end of the day, the the person with a Down syndrome in particular sometimes do not how to draw boundaries, right? If it's okay, my mom said it's okay for me to be a little bit closer with this boy with Benjamin, for instance, my son. Does it mean that it's okay for me to be close to all guys in general? They may lack the ability to judge. Is it all guys or is just Benjamin uh, whom I like to be my boyfriend, and the intimacy stops at I can hold his hand. They may not be able to stop there, and if they are with maybe a member of the public, does it hold hand and then move on to other parts of the body? So the parents do fear that the adult with Down syndrome may not understand the boundaries, so they take the safer approach, no touching at all. But you can see in their eyes, they'll come to my son, the girls will say, "Oh, Benjamin, you're so handsome. I want to be your boyfriend and girlfriend." They actually write love letters to him, which he keeps in a folder, and I sneak and read them. It's sweet but sad. That they do feel affection, they do crave the intimacy, but unfortunately, they're unable to make that fine line between boundaries that parents will trust them to be able to move forward. And of course, in Singapore, I think in other countries, I've seen it happen whereby couples with Down syndrome are able to live independently together. In Singapore, I think it will take us another 30, 40 years for that to happen. Right now, we are only looking at those who are more able to live independently, individually, not in the company of the opposite sex. So we still have a long, long way to go. And of course, I did share my thoughts that I hope that one day Benjamin will get married. Maybe the first person with Down syndrome in Singapore to get married. I actually checked with ROM, gave them a hard time. Registry of Marriage, by the way. I gave them a hard time and I got them to approve Benjamin could get married. But then a parent threw me the question, like, so you're going to be in charge of two of them now, or my daughter's going to be in your home and now you're going to look after two of them and your sons in future will look after two of them. So again, this issue of, so who's going to be responsible, not just for one person with Down syndrome, now two persons with Down syndrome. Is it going to be your job now or your responsibility, your son's responsibility? So there's always a lot of issues, surrounding all this like marriage and courtship and friendship.
Okay. My main concern here, Regina, is what I'm curious about is when you told me um they're very curious people. Okay, and I
Yes.
think when parents draw boundaries, or they limit their exposure, won't it cause them to actually want to act out more onto people? Because you're putting them in a place where they are at a mindset where everything is new. And when everything is new and feelings are new, what they're experiencing is new, and then they have parents who sort of like pull them back and say no, this is not. The reason I'm asking this is because I particularly had a patient who was also in a similar situation, but he was only he was about 25 to 26 years old. Okay, and he had Down syndrome and a little bit of autism as well. And he had parents who were very protective, very, very protective over him. And there came a time where, of course, puberty struck and there were changes, and he became to be very curious about a lot of things. And he was so much more even restricted as to watching pornography. Okay. That's why I also mentioned sometimes it's important for siblings to also bond and talk about this so that they have a safe space to say, that, hey, I'm looking at something. Is this normal? So he being the only child was only him on the field. So The restriction eventually led to him acting out wrongly onto another girl, which caused a lot of complications. Okay. So when we went back and in my center, when we did therapy and stuff like that, there were a lot of questions being brought up as to the upbringing of the child during that time when they are very, very curious. I think it's very, very critical and crucial. So a lot of parents need to really take this into consideration, because I think each and every individual, they react differently. As much as you pull, there must be also some amount of leeway given. Because if we put in our mindset sometimes that they are never going to have boundaries, then we are also going to never give them boundaries. And this puts them in a situation like they're always going to feel tied up. They're never going to be able to make their own decisions. And what if they act out? So how do you actually deal with things like this if, per se, your son were to do something like that?
Yes, I think you are very right, Dr. Rachel. You highlighted a point that is very, very common and very relevant. We do see a lot of anger management issues with young adults. As they grow older, I get parents telling me, he's always angry. He's lying in bed and refuse to do anything. He's depressed. I think this it may not just be the sexuality issues. It could be other things as well. When they see their cousins and siblings getting married, having children, and I'm not able to do that. My brother has a girlfriend, but I can't have a girlfriend. So there's a lot of build up frustration, and they act up. And sometimes they act up in terms of outbursts of anger or violence. I've seen them, really push a fridge, a fully decked out fridge, sideways, because there's a lot of frustration, and parents try to relate it to, oh no, it's because they have Down syndrome. But it is more than just it is. Of course, I know with Down syndrome, there's always some characteristics to behavior, but if you add up a lot of other issues as well, and one of them being this sexual repression, it could also add up to this build-up of anger management, anxiety, anger, frustration, especially in the young adults. So this thing about, I think you mentioned something about how do we draw boundaries. Is that correct? Did I hear you properly?
Yeah.
It is very, very sensitive. It's very, very difficult, in our Asian cultures. I can tell you till today, even in my community of parents, and caregivers, most of whom some of them have masters, they have degrees, they have gone overseas to study. Their mindset is very Asian. They really would like to err on the side of caution and say no. I rather not. I would tell them my experience with Benjamin regarding, how I dealt with his issue. I would say maybe 10% will pick up my advice. The other 90 will say, maybe not. It is. I think also maybe because it's a religious thing as well. I think in certain religion, it's also a taboo.
Yeah.
In certain religion, it's also considered not acceptable. So it could also be religious, environmental, and other issues as well. And it is not easy for parents to accept, how they deal, how others deal with it. They will take it in. How much will they share with their other kids? I think that is even more troubling. Parents don't share. Asian parents don't share their problems. They keep everything within themselves. And I constantly remind them, you're not going to live forever. You're not going to live forever. You're going to leave your son with special needs to their siblings. And it's not fair. It is not fair when you don't want to deal with the issues that is bothering your child with DS, Down syndrome, and leaving the issue for the siblings who have no inkling at all how to deal with them. It is not fair. You don't pass the issues down, you know. And this is something I repeat all the time, in my community. You can't just turn a blind eye and say they will grow out of it. People with Down syndrome do never, ever, ever, ever grow out of a problem. People without disabilities, yes, grow out of tantrums, grow out of immaturity, but not people with Down syndrome. They don't grow out of a problem. It just manifests to a bigger problem. Sometimes it becomes so difficult to manage when they're in their 40s or in their 30s. sometimes it can be almost impossible to manage. Yeah. I mean, I've heard of parents who say, I have my own methods of dealing with sexuality. And some of them can be quite outrageous. I share one. A parent, she told me she shares the room with her son with Down syndrome. And she makes it a point to change in front of him. And I thought, why would you want to change yourself and strip naked in front of your son? And her answer was, so that she's exposed to a naked body and would not be aroused by a naked woman's body. And I like, how on earth do you think that would actually help him? Would he even be more
But that
traumatized? Can I use that word?
that can
By
be.
seeing his mother's naked body almost every day. But her way with dealing with the son's sexuality was to expose him to a naked woman's body so that he will not be aroused anymore.
Yes.
I don't think it was the right approach, but she had nobody else she could ask, and that was her way of trying to deal with her son's growing, exhibition of sexual awareness. And like you say, I even have a parent that actually show the child pornographic videos so that he'll be immune to sex. And it can be frightening when you're in this community and talking to other caregivers how they actually approach this issue of sexuality. Some are
Right.
so inhibited and some are so scary.
Because they look at education, sex education for people with challenges, they always look at it as something more quantitative. Like if I show
Mm.
10 porn videos a day, he's going to probably not have so much sexual urge.
Yes, that's right.
They do
That's
not
right.
look at it as something very quantitative, and that's the sad part about it,
Yes.
which I always tell most of my patients that do not look at it like something you can balance out at home so that he or she doesn't act out in
Yeah.
public. And,
I think more importantly, I like to kind of bring out that caregivers, siblings should not feel ashamed to talk about it. It's still very taboo in especially in Singapore, to admit that you have a child with Down syndrome or other intellectual challenges or a sibling. I have young adults who say, I don't bring friends home. They'll find out I have a brother with Down syndrome and they don't want me in their group anymore because that's not cool. And and this is very common again, it's really um, quite sad. So as as to siblings and caregivers talk about it, I know that it's not easy to overcome that shame, that to admit, to having a person with challenges in your home. But if we do not take the first step out to talk about it, we can't get help. There are people out there that are willing to lend a hand, talk about it, find a solution that, my solution may not be the best solution and it may not be the right solution for everybody. But without trying the different solutions, you're not going to find at least, not 100% solution, but maybe 50%, maybe 30%, at least do something about it.
okay. So, Mina, one last question for you. Um, I was curious to know. I mean, you come across a lot of people who are living with HIV. So, what have you come across people with HIV and also probably Down syndrome or autism?
I
No, I
haven't
have not.
actually, to be honest with you, I
Oh,
haven't, so I can't answer that. But I wanted to just comment on what Regina was saying. I think we tend to dehumanize people, you know, with with learning disabilities actually, that they don't have human normal urges like anybody else, and we really need to change legislation around equal rights and parental education around managing, you know the behaviors of people, the children, that there has to be a more of a kind of a global, like a local, a country, within your country and communities, about challenging shame and stigma and taboos around learning disabilities, that actually humanity is diverse and we've got to celebrate the diversity of all of us, and from that kind of standing point, that actually as human beings we're all different, with different abilities, And I don't even like the word disability. I think they're just different abilities, you know? And that's how we need to begin to change the narrative and challenge the narrative at a legislative level as well, legally as well. But then, and also with our own communities. And, Regina, you're doing amazing work. And it's just the fear and the shame and the taboos that we come across from parents. There's so much profound fear and shame and guilt, isn't there? And it's kind of, that's a very individual thing. But I think, it's about celebrating people, people with disability, to say they are different, let's learn from them. And I look at the UK experience where, we do have, they still have some ways to go, but parents are taught how to communicate better with their children, to understand people with disability, children, and adults with disabilities, in a different way, not in our way, because they have something to offer. They are gifts to the world, and that's how we need to see it.
Okay, thank you, Mina. So I'm sure, I mean, we can keep this conversation going on and on and on. I'm really excited, but I think we have to stop now for questions from the floor. If there are anyone who is keen on asking any of the panelists and presenters questions, you may do now.
If you're shy, you may message directly to Dr. Rachael.
Yeah, if there are any questions personally, and you guys can unmute yourselves too, everyone. Any question? Okay. Any questions from the panelists to other panelists? Let's just go about that. Anything?
I just like to say, let's celebrate diversity. We are all human, we're all diverse, and we just need to embrace the diversity and challenge the cultural barriers, and beliefs and attitudes that we have, and we just need to begin to start that dialogue. I mean, we're part of that dialogue here, but I think it's more about, I think it's also a legal thing as well, and it's challenging attitudes, and but also supporting parents, because I think often they're fearful and they're scared, particularly with, adults with learning disabilities as well. Would you agree, Regina?
Yes,
Well,
totally.
Yeah.
I think there's a question here. How do we actually approach special needs who have urges? Do we engage in paid sex? If, let's say, masturbation alone wasn't enough, how do we approach? If they were having an urge or a desire to have sex with someone, do we engage in paid sex?
Is that a question for me? Do I answer that?
Yes.
Yeah, okay. I think when you approach this issue about sexual needs, it is very much dependent on the individual with Down syndrome. There is a whole range of ability of understanding. Some of them are extremely high functioning, and they're able to hold jobs, travel, live independently. And of course, on the other extreme end, there are those who need help, in every aspect of their lives. So if we take the I would say mid to high functioning range, uh, their ability to understand their sexual needs probably a little bit more uh, they're more able to express their needs, and you're probably more able to see it being exhibited. So again, as caregivers and siblings, you first of all have to see how much that person understands, the issue that he's facing. Each one of them will take a different degree of time to learn, to understand. Sometimes you tell them, that, oh, okay, it is about this sexual arousal that is happening within their body. You can tell them 3 times, 10 times, sometimes 50 times, and it takes really a much longer time, you know. Not all of them will understand from the first 2 or 3 one-to-one talk that you're going to have with them. Some of them may need about 20 sessions or 30 repetitive sessions with them before they actually understand what's going through their body and how to approach it. Okay, so it's an answer to the question whereby in terms of self-gratification, that's a very common way they tend to release that sexual urges. That is my approach would be to teach them that this is actually not wrong, but what may be wrong is to exhibit it in public, you know, in school, in the workplace, in the MRT, which we have seen it happen. But if you feel that urge, keep it until you get home. You know, do it in your own room, in your own personal space. You lock your door. You have to be very, very specific. You know, you have to tell them, close the door. Not just close the door, lock the door. You know, it's in your room, not your brother's room, not your mother's room. With people with challenges, I think as caregivers and siblings, you already realize you cannot change the sequence of your teaching. You cannot today say, okay, close the door, lock the door, but you can be in your brother's room or my room. You have to be very, very specific because they get confused if you are not specific. You know, your room, lock the door, make sure it's closed, it's locked, and then you do what you need to do. All right. After that, you go and wash up. Full stop. So if in terms of self-gratification, this is probably a more, I would think, efficient way of, you know, teaching them how they can deal with it. On the question of paid sex, I know in some other countries I've read about it, you know, that parents have paid sex for their persons with challenges. I think there was one story whereby it was on the 21st birthday and it was the parents' 21st birthday present for his child with Down syndrome. But I think in the Singapore or Asian context, I don't see it happening anytime in the next 1 century. You know, this is something that I don't think caregivers and parents are prepared to go that far to gratify the sexual desire. So I don't see that happening anytime soon. I hope that answers the question from, what is it, Chance or something?
Okay. So I think, yeah, I think you did answer the question. Right. So, any other questions before we close the session? So, no? Okay. All right. So, first and foremost, I'd like to thank everyone, all the panelists, especially and the people who have joined, people who are listening. Thank you for being a part of this program. I think we have really, really learned a lot and we have shared our experiences. And do not forget, okay, another thing is, I think for the panelists, don't forget to complete the feedback form. And for everyone, this video will be played live on YouTube. Okay, you can see it up to 30 days and feel free to join the rest of the session. Once again, thanks a lot to everybody from all over. We really, really learned so much from each and every one of you. And I specifically learned so much. And so thank you, Mina, Lionel, Regina, and Sydney for sharing. And also a big thanks to the team behind for making sure that it ran smooth without any technical issues. So, okay.
Thank you.
Thank you.
Thank you.
Thank you, seeing everybody.
Thank you, everyone.
So much for doing this.
Okay, bye-bye.
Bye.
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 Okay, we have the link for the feedback form.